So we are here with Louise, and we are going to present to you the latest innovation from a professional brand with the soothing anti-inflammatory Biocellulose mask in the new professional segment, which is the post-procedure segment. So we are going to explain all of this to you right now. Just as a quick introduction, you know it, but Dermeden is a brand that was created by a doctor for doctors. So obviously the strategy for innovating new products is completely inspired by and rooted, I would say, in medical practice. So what does that mean? It means two fairly simple things. It means that one, all Dermeden products are designed to enhance and improve the effectiveness of professional treatments that are implemented in clinics. And the second thing is that many of Dermeden's products, especially all the products home, allow doctors to provide a treatment that is used at home to continue the medical treatment and improve the overall effectiveness of the treatment. So these are really the two pillars, I would say, of Dermeden, innovations that are either in pure professional practice or on the treatment that continues at home. Today, as you have understood, we are focusing on case number 1, which is how we improve the effectiveness of professional treatments implemented in clinics by doctors. This is also why our French laboratory is recommended and adopted by more than 100,000 aesthetic clinics and doctors worldwide. So today, Lisa and I'm going to talk to you about inflammation, about the mechanism of inflammation. Why? Because in fact, when we look at the main non-invasive procedures performed by doctors, so here you have the list, we see that inflammation is the basis of every medical intervention. It is what makes the treatment effective, meaning that we will have a procedure that is somewhat pro-inflammatory to generate a skin reaction, and then have visible effectiveness on the skin. So in fact, inflammation is the daily routine of doctors. They have to manage it daily, and it is something that must be handled in a quite cautious manner by the doctor, because inflammation is sought by the doctor to achieve effectiveness treatment. But if inflammation gets out of control, if it becomes too significant, it can be harmful. This means it will create negative elements, negative reactions within the skin. It can either be the texture of the skin being damaged, burns that are too deep, or even post-inflammatory hyperpigmentation, as you know. So, Lisa, can you explain to us what are the levels of inflammation that the doctor needs to manage? And also what happens in the skin, and are there degrees and things to do depending on the degrees of inflammation?
Well, yes, we try to classify different degrees of inflammation that the doctor encounters daily. From level 1, where the inflammation will be the most localized, where we will be dealing with hyaluronic acid injections, Botox, and where here we will really have a risk of edema and redness, but in a very localized manner on the face, either on the lips, around the eyes. We will have at level 2 the level where we will see the first signs of redness, where the skin will be more rosy and have a glowy complexion. And this can be found in procedures such as with PRXT33, the very light peel, or our depigmenting peel, which is very light at Dermeden. Here it will be the first signs of redness, the first rosy hues, but we are still dealing with very mild inflammation. Level 3 is where we will see the first signs of more significant redness, and one might start to feel a bit of pain. The patient may complain of initial pain, finding it difficult to stay still, potentially because they are starting to feel the first signs of pain. And level 4 is where we will see much more pronounced, noticeable redness. You can clearly see that the skin is slightly shiny, oozing, but here we are still on redness and finally controlled redness. And level 5, where we will have more of redness related to the use of lasers. So here, in fact, the laser here is the photo, for example. It's a fractional non-ablative laser. We retrieve the photo and we can still see that there is localized and very defined redness. This is where you actually see the laser marks that have been applied. So in fact, the 5 levels I presented to you are the 5 levels where there is redness, where the doctor wants this redness, but he will still be able to control it. And we will be able to be at our level with the product we are going to present to you, because level 6, as you can see, is where we have really gone much deeper into the dermis. And we have come to use peels or very ablative, very strong lasers where we really have sweating skin with open wounds. And there we really have other post-procedure protocols key that are specific to that level where we, as we will present to you later, will not be positioned. So we will really limit and focus on these initial levels of inflammation.
Yes, because in fact, level 6, if I understand correctly, Lisa, there is a bacteriological risk of infection because we are really dealing with open wounds, sweating skin. So there we are using specific antibacterial products, disinfectant powders, all that. Some superfat tissues for very deep burns. So there we move to another level, if I understand correctly, with other solutions for the doctor.
Exactly. The doctor there will really have much more procedural protocols. Post-procedure, because the wounds are open, there is a risk of infection and superinfection. And no, we are not going to position ourselves at that level at all. All right. So here we are going to focus and present inflammation to you. And actually what you need to know when the doctor is going to start his procedure is that there will be an initial inflammation, which will be the immediate inflammation. The inflammation where immediately, as we presented just before, we will see the first signs of redness, depending on the level of the procedure. And of course, the levels of redness, the levels of pain for the patient. And actually, it's this immediate reaction that we are going to work on and focus on. It's this reaction where really it's the moment when our body doesn't have the time to understand what happened in inflammation. It will really come to attack and defend against a potential pathogen. And the inflammatory reaction, you will see it goes a bit in all directions where there are many hot sites and many chemical mediators that will be activated to reduce this immediate inflammation. This is the one we are going to focus on. And actually, we are interested in this immediate inflammation because it is the one that occurs during the act, during the procedure. So the procedure begins. And actually, as soon as the doctor applies a peel or performs a laser treatment, it sends a message to our well-known sentinel cells, which are the leukocytes, and commonly known as white blood cells. These molecules, since they are always sentinel cells, are the ones that will be present in our blood vessels, in our epidermis, and will be activated. As soon as there is a pathogen or inflammation, a burn, pain, or external aggression, these leukocytes will activate and trigger inflammation in the body. They will activate chemokines as a result. This will allow the development of all the other mediators we will have. In this immediate inflammation, we will have 3 main categories of mechanisms that will be activated. First of all, it will be vasodilation. Vasodilation will allow slight swelling at the level of the blood vessels, the diameter of our blood vessels to allow the arrival of cells that will come to try to find the pathogen and reduce the inflammation. So the first action in the body will be vasodilation, which will be activated by histamines. And this will increase the permeability of this area. Inflammation will also be largely managed by cytokines, which are very important mediators in the body. And actually, we will be able to divide them into 2 parts. The pro-inflammatory cytokines, which will activate and overactivate our inflammation, the inflammation mechanism, along with the other mechanism, the other anti-inflammatory cytokines. And in fact, it is this balance between the two that allows for the regulation of inflammation if this balance is not maintained, we can potentially have an overinflammation because the pro-inflammatory cytokines will take more of a level. This is what allows the inflammation to be measured. To regulate the inflammation, this is how our body naturally will measure the inflammation depending on the aggression. Depending on the aggression and the level of inflammation, it's normal for the pro-inflammatory cytokines to start because we are seeking inflammation, but we must immediately activate our anti-inflammatory cytokines to prevent too much degradation, which we will show you later, of all the proteins present and all the cells present at this site. So this is inflammation by cytokines. And the last pathway that will also be activated is the vascular pathway, which we know very well with our tranexamic acid. And in fact, this is where we will activate the plasmin. And actually, this plasmin will have a central role on the metalloproteases like collagenase, like elastase. Plasmin, as soon as there is inflammation, will activate these destructive enzymes of collagen and elastase. Because in fact, as I explained to you, immediate inflammation is where we attack everything. We will somewhat destroy everything at the site of inflammation. And that's what we want, to then be able to restart healing and consequently restart cellular regeneration. But consequently, the faster we stop these mechanisms, the faster we will reactivate the purpose of cellular regeneration, so new cells, etc. So here, what we are interested in is actually realizing that the first step of inflammation is to come and destroy everything. And that's what we're going to try to control, and that's what we've worked on with our scientific board. So here what we realize is that as soon as we trigger inflammation, as soon as we initiate the action, the skin turns red. And the question we were asking ourselves is how to immediately reduce this inflammation. Because it's done, we've triggered it, the patient has undergone the procedure, the patient experiences pain with certain medical procedures. So we can immediately provide comfort, reduce their pain, reduce the inflammation, the redness, so that they don't leave the procedure with skin that's really too damaged. So in fact, this is the need we've identified and that we are going to address today.
Yes, and without massaging it, because it's true that generally the skin is very painful. The doctor cannot come and apply a topical product by massaging because it's too painful for the patient.
So here we are going to try to develop an anti-inflammatory solution that will be applied directly to the face without too much massaging, as Marion mentioned, for the patient. And actually, this is what we have worked on with the scientific board, with our partner doctors. And we have thus launched the famous soothing biocellulose mask. So it's a post-protocol, post-procedure mask that will directly reduce skin inflammation. So in fact, inside we have added 4 medical grade ingredients with tranexamic acid that you know very well at 1.8%, niacinamide at 3%, panthenol at 1%, and hyaluronic acid at 3%. I will explain everything to you afterwards, the rest about each active ingredient, of course. But in fact, it's the combination of the 4 with our support that is very specific to Dermeden, the biocellulose. And actually, it's this combination that will really allow us to have this uniqueness in this product to help reduce inflammation, improve the patient value. We will also activate cellular regeneration with our product, limit post-inflammatory hyperpigmentation, hydrate the skin after inflammation, and reduce the patient's sensations of pain and heat. It's a mask that can be used after certain medical procedures that we will explain to you and can be combined with LED therapies. So everything related to LEDs, which we might also potentially see. As we explained at the very beginning, our mask can be used after any procedure between level 1 and level 5 inclusive. We are not going to place our product because we haven't tested it. And because we know that the procedures are very specific, when the doctor uses an ablative laser or performs a fairly deep TCA, a deep TCA peel, the skin, as we mentioned with Marion, is oozing. The wounds are more raw, and as a result, they will use other types of products, which will be antimicrobial powders or very greasy ointments, where we will really occlude the skin to ensure it is not contaminated by another pathogen. And since we are dealing with a non-sterile product, our mask being non-sterile, we did not position ourselves at that level. As we explained to you, we included 4 active ingredients inside: tranexamic acid, hyaluronic acid, niacinamide, and panthenol, which will act directly on the proteins and chemical mediators to immediately stop the inflammation. The idea is that we have triggered the inflammation, and now we want to stop it immediately and as quickly as possible to activate cell regeneration and allow a return to a normal state and reduce the inflammation. And what we see is that here the niacinamide, panthenol, and tranexamic acid will have the role of acting directly on inflammation and on our pro-inflammatory cytokines to lower their levels, while tranexamic acid and hyaluronic acid, as we know, will play a role directly on the vascular pathway to reduce metalloproteinases.
Tranexamic acid will have a very interesting action upstream of the pathway activation plasminogens. That's what's very interesting. It's upstream of the entire cascade vascular. And hyaluronic acid will be more towards the end of the chain, that is to say, on the entire enzyme mechanism of activated collagenases. So it will come more at the end of the chain, whereas tranexamic acid is upstream of the chain.
It's true that they won't have a role in the same place of inflammation, and as a result, we will come to stop the sites of inflammation, especially several stages of inflammation, and as a result, ensure better action. Exactly. Hyaluronic acid is more about the consequences. So here we will present the ingredients that we have added inside. So we focus first, as you already know quite well, on tranexamic acid, which will help prevent post-inflammatory hyperpigmentation. As you know, it acts on the vascular pathway, but also on the pigmentary pathway. And actually on the graph, on our left, we can see that when TXA is applied directly after a laser, we see a significant reduction of the risk of PIH by 57%. And what we explain in the diagram on the right is that as soon as there is inflammation, we realize that the TXA, which is right here, will act on the plasminogen pathway. And thus, as Marion mentioned, it stops upstream the conversion of plasminogen to plasmin. The consequences are to activate growth factors. We will stop this entire chain upstream, but we also realize that tranexamic acid will act on our pro-inflammatory cytokines, as I explained to you. These are specific names of pro-inflammatory cytokines. We will have a dual action of tranexamic acid here on the vascular pathway and on the pigmentary pathway.
Tranexamic acid is a very interesting active ingredient, both for pigmentation and also for inflammation. But we knew this because we know that inflammation is closely intertwined with the process of hyperpigmentation. However, here on this post-procedure mask, it is also very interesting.
So now we will focus on niacinamide. And in fact, what we wanted to highlight here is that niacinamide directly inhibits the mediators, which will activate our pro-inflammatory cytokines, as I indicated to you just before in the diagram. And so, in fact, here we have a significant reduction in inflammatory mediators, pro-inflammatory cytokines. Here we focused on hyaluronic acid. And in fact, this is what we have seen in research in the scientific literature. It's that, in fact, hyaluronic acid is already present throughout the extracellular matrix. In fact, it is present everywhere. And in fact, it plays a central role in the inhibition of our well-known metalloproteases that we presented to you at the end of the cascade. It will really come to reduce and inhibit the expression of these metalloproteases and, as a result, promote and enable the synthesis of new collagens.
So just regarding this point, because when there is an aggression and a pro-inflammatory act, there is inflammation. So the patient is red, so there is destruction of many fibers, collagen, elastin that occurs, and that's done. At the end of the procedure, adding an active ingredient that will stop, that will reduce and calm this reaction. Enzymatic, I remind you about enzymes, everything that ends in AC are enzymes. They are like little scissors, and in fact, they are scissors that will cut the fibers. So there is a point where you also need to stop, that reaction. That's why Lisa tells you it's right at the end of the chain. The entire inflammatory cascade generates an overactivation of all proteases, all enzymes, and thus the little scissors. The destruction, in turn, generates cellular regeneration. So it's interesting. That's actually why the doctor induces inflammation. So we keep that, but it's important. Once the skin is very red, the inflammation is done. All these signals are sent. It's also important to calm things down in terms of destruction, to soothe the inflammation and this enzymatic reaction at the end of the chain, so that we can to also limit the destruction process, which then becomes less easily controllable.
Exactly. So here we focused on dexpanthenol. Dexpanthenol, in fact, is a molecule already. So first of all, why did we use dexpanthenol? Because it's the active form of panthenol compared to the others, and it's the one that will have an effect when applied topically. We decided to choose this molecule, to select it, because we saw that it also reduces the expression of pro-inflammatory cytokines by regulating the proteins that help reduce these pro-inflammatory cytokines. We can see directly in the graph that dexpanthenol after a laser application will increase the expression 1 non-punda of these proteins, which in turn will reduce pro-inflammatory cytokines and allows for an active inflammatory response. That's why it's also very interesting for topical application. What we have shown you is that these 4 active ingredients, these 4 components, will have a direct effect on inflammation and the mechanism of inflammation.
At all levels of the cascade, that's what's interesting, is that it is then there are ingredients that we find, as you will see later, rarely in the competition. And what's interesting is to mix them together to really have an effect on all levels of the inflammatory cascade. So Lise presented to you and explained why, with Dr. Bachot, we chose these medical ingredients to calm the inflammation caused by the doctor's procedure. The question is the method of application. Lise talked to you about it earlier. When a patient is very red, we can't touch them, it hurts. So the question is in what to infuse all these highly treating actives. And the choice we made with Dr. Michaud is the choice of biocellulose, which is currently the most advanced technology for treating masks. In fact, it's a biocellulose mask. You have the photo on the screen. I don't know if you can see this well. We might put this behind. This is how biocellulose looks. In fact, it's transparent, it's translucent. It's not infused with active treating agents. And you will see it has particular properties, especially in burns. We have tested this mask here. We tested it post-laser, but also after chemical peels. And it works, and this is very interesting, in perfect combination with anti-inflammatory LEDs. So what is it originally? Biocellulose was actually originally developed by German scientists for the treatment of severe burns. And it's particularly interesting. Why? Because this texture will have much better adhesion and occlusivity compared to fabric masks. And this is what will accelerate healing and allow the anti-inflammatory agents to penetrate the skin better. I will explain all of this to you just out of curiosity. How are these biocellulose masks made? I could say simply, but in fact it's not simple. Since it's a biological fermentation process where small bacteria are fed in a plant-based substrate, and these bacteria will build networks of microfibers. We will see extremely fine, much finer than the fiber of your hair, for example. And in fact, it's these fibers that will come together and form the Dermeden mask and all the technology as well. of the development of this product, it was first this manufacturing technique, and second, the thickness. It's about knowing when to stop. This fermentation, this production by bacteria of different fibers to achieve the right texture, the right thickness. So better occlusion, better adhesion, you will see it's very important in the treatment of inflammation. And no paper, of which sometimes we don't really know the origin of the materials used to make the paper. So we are talking about a biocellulose mask that is going to be very, very occlusive. Occlusive means that it will adhere extremely well to the skin. And thanks to the extremely fine fibers, I mentioned them just before. In a Dermeden biocellulose mask, they are 350 times finer than in a classic paper mask. And to give you an idea of the fineness of the fibers, it's 1,000 times finer than the size of one of your hairs. So it's really extremely fine. Here we are talking about nanofibers. And in fact, they are so fine that they will mold perfectly to the skin. And through this occlusive action, it will open the pores. And so the ingredients infused in the mask will be able to penetrate extremely well. So a very strong penetration, we will see it. And at the same time, the skin can breathe. This is very important. So it's what is also very interesting about biocellulose is that there is a bidirectional process in two directions. Firstly, the active ingredients will penetrate very, very well into the skin. And secondly, the skin can still breathe without too much evaporation. So it's quite a technical balance. It is very interesting in healing and anti-inflammatory action. So highly occlusive, yet breathable. And we are dealing with enormous delivery capacities, meaning that the molecular weight of the biocellulose, 1 gram can absorb up to 100 times its own weight. So it's really a bit like hyaluronic acid. They are truly sponges that can absorb a lot. And so it's very interesting. Why? Because as you have seen, we chose very powerful active ingredients, and therefore we wanted a mask support, a texture that could absorb a lot of this treatment serum to have immediate effectiveness, and thus not wait 20 minutes before the inflammation starts to decrease. So here we have seen that Dermeden biocellulose absorbs 30% more serum than a traditional paper mask. What is also interesting is that we have very low evaporation. We are at only 8% evaporation, whereas if we compare that to a paper mask, it's at 27%. So completely inclusive. For better penetration, we can see it. Then a fiber that absorbs a lot of active ingredients to be able to better redistribute them within the skin. And low evaporation. So better efficiency. So here is the summary of what I just told you. You have the occlusive aspect, which is central to the effectiveness, making the fibers much finer than a normal mask, and which will allow better penetration while allowing the skin to breathe. As a result, the consequence of this is a very, very good absorption, which is 10 times greater. That's quite significant. And you see, there's 30% more serum. I don't know if you still have one in 1 gram of biocellulose than in a normal mask. And then low evaporation, I mentioned it to you. So what does that result in? In fact, in a very simple way in daily life, and thus in the properties of this product, the consequences of these physical properties, if you will, is that the biocellulose will allow us to be much more hydrating and soothing than a regular paper mask. To have active ingredients that are much better absorbed. The active ingredients will be enclosed a bit, really, completely directly in contact with the skin, which will make them penetrate much better. And the consequence of that is that we will have much faster results, and they will last much longer. And why is that? It's decisive, if you will, because, as I mentioned earlier, Dermeden, it's a brand created by a doctor for doctors. And as a doctor, Dr. Nicolas Bachot, he knows very well that when you have a client, a patient undergoing treatment, a treatment that is at the end of its course, if you have to wait at least 20 minutes before, the inflammation starts to decrease. It's complicated to manage in the patient flow. It takes a lot of time. So that's why we wanted to have quick results with an immediate effect. So the longer you leave it on, the better it is. But already giving this freedom to doctors, depending on the degree of inflammation, to safely choose how long the mask can be applied. This is to explain to you the story of the biocellulose thickness that we managed to achieve. Because the thinner it is, the lighter the mask will be, the better it will adhere. Please, it will really adapt to the face and be more occlusive ultimately. And as you understand, the more occlusive it is, the better, and the absorption will be, and there will be less evaporation. So the faster we go, the more effective it will be. That's why Dermeden biocellulose is light. It perfectly adapts to the face, which means that for the doctor, it's very practical because the patient can get up, go to their chair under the LEDs without everything dripping, or the mask falling off. That's important. And above all, one of the great advantages of this mask is its immediate relief. There are other biocellulose masks on the market, but they don't all necessarily have the same thickness as ours. Sometimes they are thicker and therefore they adapt a little less well. You see, as shown in the photo, they fit a little less well to the patient's face. This creates small bubbles, small folds, so the occlusion is a bit less effective and it can fall off, obviously. Then we have paper masks. So that's not the same at all. You can really see the lack of adherence. It lifts up all over the place, and as a result, the penetration will be much less, and then it can fall off with the liquid as soon as the patient moves. So this mask is really the ideal complement after an aesthetic procedure to soothe inflammation, because it acts very, very quickly. You already have immediate relief. As soon as it's applied to the skin, the patient feels relieved. So this is a real performance that matters in a doctor's life for their patients. Then it's up to the doctor to decide how long to leave it on the patient, depending on the degree of inflammation and their organization. Between 10, 15, 20 minutes or more, it's up to them to decide. It's also very important to remember that this mask works in synergy with LEDs, and that's quite unique because in fact the thinness of this mask and its texture itself will maximize the penetration of anti-inflammatory lights into the skin. So doctors often, after a pro-inflammatory procedure, they are used to systematically placing under LEDs. Here, what needs to be told to them is that this mask will maximize the effectiveness of the LEDs and will ensure that, in addition, the LEDs will enhance the effectiveness of the mask. So it's a bit of a win-win because they will enhance the penetration of the anti-inflammatory actives from this mask into the skin. So the result is quite visible. Look, this is the half of the face with the biocellulose mask. And this is the part without the mask in biocellulose. So you see that in terms of temperature, we are more in the range of 30 degrees here due to the inflammation. And here we are in the yellow-green range. So much weaker. And then you also see here with a biocellulose mask, without a mask, in biocellulose, you can immediately see that the skin here is much less red, even if we weren't dealing with a major inflammation here. These are things that are important for a doctor, that the patient does not leave the clinic red. So now Lise is going to show you the different clinical studies that have been conducted on this mask.
Yes, so we conducted a clinical study with our scientific board under dermatological control, of course, where our board, Dr. Nicolas Bachot and Dr. Dalboche, used our mask after their medical procedures, whether it was chemical peels, lasers, or microneedling, as we mentioned. They fit well within the levels of inflammation we presented to you at the beginning. So they used and tested the product on, quote, 60 volunteers directly who had different skin types, and they left it on for 10 to 20 minutes combined with LEDs. And in fact, what we realize is that we already have the before and after photo. You can see it. It shows directly just after the procedure. In this case, it was microneedling. We really had a red area. And there, it was just after we removed the mask. In fact, there is no visible redness at all anymore. We measured the erythema index with Cortex. And in fact, what we also see here is that we really have a return to normal of the erythema as soon as we remove the mask after 20 minutes. The irritation increased right after the procedure, which is normal since we triggered the inflammation, and it immediately returned to its original value. We measured the melanin index, and what we see is that we did not have any PIH, we did not have any post-inflammatory hyperpigmentation right after the procedure. And after the 20 minutes of mask application, we really have a melanin level that remains stable throughout the procedure. These are very important and strategic data for the physician to reduce the risks of inflammatory hyperpigmentation, to reduce the risks of overinflammation, and to ensure that the patient comes out of the procedure as well as possible, with as little redness as possible and of course as pleasantly as possible. And what I could also say is that it's the immediate sensation of freshness that comes over the face and provides real comfort to the patient. It's really an added value for the physician, I think, to add this act to their procedure.
Just a clarification. Regarding the before and after photos, it's originally a video. So there was no light bias, nor of time. That is to say, these are excerpts from the video before and after 20 minutes. So it's very important to note that the lighting did not change between the two. It was the same moment. There is no light bias, and thus the redness you see here. And then its disappearance afterward. It's really in a video, so there was no bias at all.
So what we observed is that among these 60 volunteers, we had no issues with irritation, whether it was post-cleaning, post-laser, or post-microneedling. And the product completely matched with the LEDs. So if the doctor, as Marion mentioned, uses red LEDs to reduce inflammation, they can completely combine it with our mask. And these are often the questions they ask us first. Can I combine it with LEDs? Can I use it post-peeling? These are really strategic pieces of information for the doctor. So we had no issues with irritation. And so here, to present to you a little bit about the clinical trials where we were really able to test this mask after different protocols.
Then when we say test it post-peeling, remember, it's not for all peelings. You know, there are different levels in peelings. So obviously it's not after deep peelings, because there we get into bacteriological issues. As Lisa explained at the beginning of the presentation, where sterile products, disinfectant powders, things like that are needed, we are really dealing with specific protocols here. But post-peeling, which are superficial and medium, there is therefore no issue in applying our mask right after. That's it for our post-procedure mask. It's a new segment. Look, here. It is well placed here, post-procedure. It's a new segment in the professional range. We have Mela Protocol, the first segment of the professional range. The two Mela Protocol products to treat hyperpigmentation and radiance. And this is the new post-procedure segment. It's the first product of the post-procedure segment. There will be others. How does it present itself? We are indeed talking about a mask that is extremely infused and concentrated with medical ingredients with a biocellulose that allows for very good penetration, maximum absorption, and immediate relief. All right, yes. It's the identity card: tranexamic acid, niacinamide, panthenol, hyaluronic acid, and biocellulose. Biocellulose is also very important in the product's discourse and activity. So we are dealing with a non-sterile product, as we mentioned, obviously without alcohol, parabens, or fragrances. Clearly, we are really focusing on an anti-inflammatory mask with a limited number of ingredients compared to what you might find on the market, where generally we are dealing with competing masks that have at least 20 ingredients, whereas we only have 11. So I remind you, the fewer ingredients we have, the lower the risk of allergic reactions. And so it's a gel formula to prevent it from dripping everywhere. There is a lot per mask, 25 milliliters per mask. So it's really a treatment mask that should be kept in the refrigerator, not for preservation reasons, but more for comfort and enjoyment reasons. It will integrate into the new post-procedure segment, which is exclusively reserved for doctors and aesthetic clinics. And it's really the products that go into this segment are the ones that will be the perfect combination with medical procedures. It will enhance the effectiveness of medical treatments. So here we have this mask, soothing, anti-inflammatory, and restorative, as you would have understood in relation to healing.
Unfortunately, what we actually see is that we are, as Marion said, on the only product on the market with its 8.8% active ingredients. Biocellulose, as Marion mentioned, we really infused it with 25 milliliters of formula with these active ingredients, without alcohol and without fragrance. And that's what immediately sets us apart from other medical brands where there are zero or very few active ingredients, very few infused products. If you look in more detail, you'll see that there is less ml per biocellulose, and especially that there are far fewer active ingredients, or even none at all. So it's a little bit, and this is really our big difference here, that we have infused it with a very high dosage of actives to truly achieve results where we will hydrate, soothe the skin, and thus provide an anti-inflammatory response for the doctor and the patient immediately. And so here, this is what we have also worked on. What we know is that, in fact, this mask will be included in the procedure by the doctor. And so we really had a challenge on the sale price to offer doctors the most accessible price so that it does not impact its price too much. Procedure, and we really worked on it with our partners to position ourselves as the most appealing mask on the market for doctors. We position ourselves among the most appealing medical masks. We are at 34.95 euros for 5 masks. And in fact, we came to work on it. The price per mask, therefore, per patient. And we are still the most challenging and the most appealing. And we end up with a mask for less than 7 euros for the doctor, with dosages shown and certified on the product. So we really, among all the competition and among other medical brands, worked on the price, worked on the active ingredients, worked on the biocellulose, because it is very specific to us compared to competitors. And in fact, that's what will really have a strong added value. And that's what we saw at Incast, as Mariam will explain to you later. So there you go. We are really at a very accessible price for the doctor. And the most interesting on the market.
Despite the fact that it's immediately apparent, we are more loaded with treating molecules, that is to say, in terms of number and in terms of concentration. So you see, that was the whole challenge of the IS. It was to successfully combine this medical effectiveness with a price that is easily absorbable by the doctor to systematically include it. Post-procedure, after all the procedures, they implement.
Exactly.
So that's the presentation of this mask. In summary, the benefits. It's very important. There will be an anti-inflammatory effect that will allow for better healing. So we reduce redness, inflammation, and pain for the patient. So this is what is visible and what is felt immediately. So this is very important because it ensures patient satisfaction and therefore doctor satisfaction. It is very easy to use since the mask adheres very well to the patient's skin. It allows for a lot of flexibility in the procedure. You can change rooms, wait in a waiting room or wait under assistance. It's very flexible for the doctor, easy. It doesn't need rinsing. You just have to remove it and the patient can leave and Above all, it will also improve healing. This is something that is very important. And you know the role of hyaluronic acid in healing and also in reducing inflammation. The active ingredients, you have them here. It's 8.8% in total, which is huge. Generally, there's a tiny amount of hyaluronic acid in competing masks. So this is a real strength here as well. And then it's one of the only soothing masks that acts on the plasminogen pathway, which is the pathway that generates, as a result, everything related to genesis issues like redness. So it's really a unique point for the product. It's the action of hexamexytrine on the plasminogen pathway that is very important. And then there you go, it's for all skin types. We have seen the degrees of inflammation that are treated are very broad. There is only 1 degree of inflammation that is not treated by this mask, which is when there is a risk of bacterial contamination and superinfection. We have strengthened the speed of action because of the texture, the thickness of the biocellulose, and because the dosage of ingredients means we act immediately. And that is very rare. Generally, it's a minimum of 20 minutes. So here you have a real difference to highlight. And it will also enhance the effectiveness of anti-inflammatory LEDs. So that too is a difference. So you will have a pack with 5 masks per sachet. And each mask is infused with 25 ml of treatment solution. Here, you have the retail price, which is 34.95 euros for 5 masks. And we have an export price that is slightly below 11 euros. There you go. For the mask, we will show you here. How I'd apply it, it's very simple. There are different layers in the mask. You need to remove the plastic film. This allows the biocellulose to adhere. You can see it right away. See how it adheres to the skin. Immediately, it sticks completely to the skin. And there you go. And then when the doctor decides that depending on the inflammation, it's time to remove it, it's very easy to remove. The mask is also biodegradable. It's a little bonus, so there's no need to rinse. And if the patient is not too inflamed and there's a little bit of the product left remaining on the skin, the doctor can massage to allow the complete absorption secured of the treatment solution. And well, that's if the inflammation isn't too severe, because otherwise it's not possible. Nothing drips, it's a gel, so it remains very practical. So to summarize, when does the doctor use it? In fact, all the time, meaning whenever they perform a pro-inflammatory procedure, which is to say all the time, whether it's a chemical peel, a laser, radiofrequency, or fillers, or electroporation. Well, we haven't listed everything, it's impossible, but whenever there's inflammation, one should reflexively use the post-procedure mask Kitoi to immediately soothe the skin, accelerate tissue repair, and also, since it contains tranexamic acid and niacinamide, prevent hyperpigmentation, post-inflammatory. But there's also another way to use this mask, as you might have guessed. It's the new 3rd step of our professional treatment. That is to say, in depigmentation, you know, there are 3 steps. There is step 1, which is the light depigmenting peel. Then we follow up with the application, whether it is topical, post-laser, or microneedling. Regardless of the application method, you have the sterile TXA concentrate, which is a depigmenting concentrate. And the 3rd step, and this is new, is this mask, because not only will it be soothing, since we are typically dealing with things that are pro-inflammatory. I mean, a peel, even if it's light, the skin is slightly red, as Elise explained to you at the beginning 2 of the intervention. And so here we will systematically soothe with this mask and continue to treat, because obviously we have tranexamic acid, so it continues the penetration It's very interesting because the biocellulose, as you saw, is highly occlusive. So there is a very, very strong penetration of the active ingredients. So it is also very interesting to apply this mask to complete the depigmentation treatment, because the tranexamic acid will penetrate extremely well into the core of the skin, especially after peeling and microneedling, for example. So here we provide even stronger penetration with this mask. And niacinamide 2, which is a pigment corrector, I remind you, is anti-inflammatory. So it is also a mask that can be used as the third step in the pigment correction treatment. So to summarize, this mask should be used all the time, regardless of the procedure. As soon as it is pro-inflammatory, you apply it as the final step. And if you are in the specific case of a depigmenting treatment, you finish with this mask to further enhance effectiveness and prevent post-inflammatory hyperpigmentation. So there you have it. It's a mask with a lot of properties, which has the best quality price ratio, value for money, as we have seen. When we presented it at our booth at Limcast, the doctors literally rushed to it. In fact, our entire stock was sold out in 2 days of the Congress. This really confirms the doctor's appetite for this treatment product. What happened is that we ran out of stock at the Limcast booth. We took pre-orders from doctors and immediately started a new production, which will arrive for you in April. What's happening is that it's going to go very quickly because we already have pre-orders on this product. So it will sell out very quickly and it takes time to be produced. Therefore, we strongly advise you, especially for this product, to start placing your orders now to secure your stock and avoid running out. When your registration is ready, especially since I believe that all the registration procedures and information for registration have already been sent, so it will go faster. So pay close attention to pre-orders to properly secure your stocks to avoid running out of stock, because then for us it takes more time to produce this type of product. There you go. So I hope that's clear for you. Here, obviously, lad, you have the photos and contacts of who does what within Dermeden, and we'll meet again right away. You return to the meeting link so we can quickly go over the different questions. And so there you go. I'll stop sharing and we'll meet again right away. I'll see you very soon.